Good afternoon. My name is Sharon. I am a patient of Dr. Ali. I'll just give you sort of a brief history of how I ended up here today. I have had 2 pregnancies, and during the many years that my husband was unfortunately very ill and I was working and caring for him, during that period of time, I also ended up very overweight. And 2 years ago, I went to an endocrinologist and he said, "Ooh, Sharon, you genius, you're insulin resistant. You need to stop eating carbohydrates." So I did. I took that very seriously. And over the course of a year or so, doing that, being very careful with what I ate, having a little more time to exercise, I lost about 105 pounds. And I was at my goal weight, but had a lot of, just as I called it, glob that was never going to go away. And I had actually talked about this quite a bit with my husband. We had the, boy, if I ever lose weight, I'm going to have a tummy tuck conversation many times. And, he was all for it. He unfortunately passed away in the summer of 2023. And I was still thinking about doing this, but I had a lot of hesitation. Honestly, I thought to myself, well, why would I do something as big as this when there's no one really even to appreciate it anymore? I have 2 young adult daughters, and they said, well, Mom, you'll appreciate it, so that shouldn't that be enough? And I also worried about things like, okay, I'm a widow now, and what if something happens to me when I have vanity surgery and then my children are orphans? So I went into it partly really wanting to do it and partly with a lot of hesitation about it. And I expressed that to Dr. Ali in the initial consultation appointment. He's a very attentive, gentle, quiet, good listener sort of person, which I appreciated. From the moment we met, there was nothing about the meeting that was anything along the lines of him trying to talk me into this. If anything, we sort of covered every possible reason not to do it. So what we agreed on was sort of a very, probably overly thorough preoperative evaluation. I saw my endocrinologist again. I saw a cardiologist. I went to a hematologist because at one point a number of years ago, I had a blood clot in my leg. And even though I'm a physician, you would think I would have figured this out. It was sort of unclear to me at the time whether it had been a superficial clot or a deeper clot. And if it had been a deeper clot, that would have made me at really high risk for this procedure, and we probably just would have bagged it all together. But we figured out that that wasn't the case, that it had just been a superficial clot. And actually, even part of the process was an appointment with a psychiatrist to see, why do you want to do this? Do you think this is going to change your life in any way? And I got the impression, talking to the psychiatrist, who was very nice and told me he had also lost a lot of weight at one point, that evaluation was geared more toward the I'm getting ready to lose a bunch of weight people, and to see, if you had some fantasy that suddenly your life was going to be markedly different. And I told him, no, I've already lost the weight, and yes, my life is different in a lot of ways. I feel better, I look better, I don't use CPAP anymore, I'm not on blood pressure medicine anymore. A lot of good things happened as a result of that, but those changes had already been made, and this particular surgery was just so when I got up in the morning and looked at myself in the mirror, I would think, wow, instead of thinking, yikes. So, it was a very extensive evaluation over probably 6 months or so. It's an overnight in the hospital. He explains in some detail his method with using local anesthetic at the time of surgery, not using drains. So I had a good understanding of those things going in. And I will say the local anesthetic technique, is amazing. I asked for no pain medication at all while I was in the hospital, not because I'm so, groovy and heroic, but just because I didn't need it. And likewise, when I went home, I didn't need any narcotic. I think I maybe took the Celebrex once or twice, but, from a pain standpoint, there wasn't much particularly. Immediately post-operatively, because everything is sewed up so tightly, you are kind of hunched over like this. And fortunately, from my husband's illness, we already had an adjustable bed. So it was easy for me to kind of sleep in a sitting position and push myself all the way up into a sitting position to get out of the bed. But that was more a matter of being careful when I had the sense of things feeling tight, as opposed to anything that actually hurt. Before the surgery, he had suggested taking 6 weeks off of work, which in my job, A, I couldn't, and B, I didn't really think I would need that long. I had had a hip replacement several years ago and, was able to go back to work less than 3 weeks after that. So I sort of compromised and took 4 weeks off, but truly I could have gone back to work at the end of 3 weeks, which for me is a 12 or 13 hour day on my feet all the time. So, but I felt fine. I will say that I tried to be the world's most compliant patient. Actually, another plastic surgeon that I had seen first who rejected me because he thought that I had had this clot, which actually was the best thing that ever happened to me. A, because he sent me to Dr. Ali, and B, because Dr. Ali was the person with the procedure that I really needed. But he had suggested like a specific type of vitamin C for wound healing. So I started taking that several months before the procedure. I was careful to eat probably at least 80 grams a day of protein. I was meticulous with, the bathing. Even though he keeps telling me I don't need it anymore, I'm still kind of addicted to my little, compression garment thing that I wear just because I want everything to heal nicely. One of the other things I was kind of worried about going in is for this procedure, the belt lipectomy, when you look at the pictures on the website and you see everybody's nice flat tummies, that's true, but it is kind of a Frankenstein-y scar. It is a circumferential big scar. I barely notice it anymore because I see it every day. It's healing very nicely. The front half of it is probably less noticeable than the back half, maybe because you lay on the back, and I don't know why, but the back is a little bit darker. But where it's positioned, it would always be hidden under your underwear, under a bathing suit or whatever. So as time has gone by, that's been less of a concern because I just don't really notice it anymore. So the scar is healing very nicely. They give you a long list of potential complications before the surgery. You can have dehiscence, your scar coming apart. I fortunately did not have that problem. I didn't have any infectious issues with my scar. I didn't get seromas, any sort of fluid collection. His technique for avoiding that seemed to work very well. I was religious about the medication regimen that he gave me. He has you do a diuretic for a month to prevent excessive fluid collection. I will say about 6 weeks after the surgery, when I finally picked the last of the glue out of my belly button, I had a little bit of clear drainage from my belly button and it was a little bit red around there. So I called up and I told him that. I squirted peroxide in there 3 times a day and took antibiotics for a week, and that completely resolved that problem. So it's all continued to heal very nicely and it looks amazing. I never looked like this when I was 20 years old, much less at 63. And I show people, I'll be at work and somebody will comment on it. One of the other, women doctors in my practice or one of the nurse practitioners, I'll be like, you want to see? And we go in the call room and I show them and everyone's dazzled. I have a group of medical school friends and we take a trip once a year. And they had seen me last year after I lost the weight, but this year I, had the flat stomach and I hadn't told them that I had the surgery. The only one who knew was a friend who lives here in Dallas, who actually was the person who drove me to the hospital that day. So the house we were renting had a hot tub and I came out with my super flat stomach, and everyone in the group ranges in age from 63 to 73. So, none of us have perfect bodies anymore. And everybody's like, oh my God, Sharon, how did you get such a flat stomach? And they thought I was going to say I did Pilates or this or that. I said, I bought it. So I am, 21-ish weeks out now. And he said that, as he described, that the final shrink wrapping effect is at about a year. But even if I just looked like this for the rest of my life, I would be delighted. In summary, it was something I had thought about for years and years. I went into it with a lot of trepidation. The process leading up to it was very slow, very meticulous, very detail-oriented, so that all of my questions were answered, all of my concerns were assuaged. The procedure itself went flawlessly. I actually had the unusual opportunity of being able to watch a movie of my surgery, and I have zero regrets and could not be any happier, and get compliments every day, which is lovely. That was not really the intent. The intent was for me to feel good about myself. Depending on your circumstances, I would highly recommend it. I would not make any decisions differently. I feel so fortunate that I ended up with Dr. Ali, because there is a big difference between belt lipectomy, which I had never heard of, and just sort of standard tummy tuck, which would definitely not have gotten the job done for me. And when I look now at even the preoperative pictures from what they call marking day, you come in for about an hour and a half to 2 hours the day before your surgery, and he takes a Sharpie basically and marks all over you where he's gonna cut, this is gonna go, that's gonna go. And when I look at those pictures versus what I look like now, it's two different people. I look at myself in the mirror for once in my whole life and I think, wow. Well, I am a doctor, so I have a lot of experience hanging around with other doctors. Dr. Ali does one of the things I always do, which I think is really important, and that is, even if I or he is short on time, when I see him, he's always seated. You come in, you sit down, that just says to the patient, you have my full attention, I have plenty of time for you. As opposed to, I'm standing up, typing on a computer, not even looking at you. My appointments were long. He never made me feel rushed. He answered every question I had. Sometimes I'm sure I asked the same question more than once. He's humble and kind and spectacularly talented, I think is how I would sum it up. My advice would be, especially if you're in my age group, just by being in your 60s, you certainly have some probably additional risks from a 6-hour, very extensive elective surgery. I thought it was well worthwhile to do the preparation that I did. See a cardiologist if you've ever had any concern about a bleeding issue, whether it's a clotting issue or a bleeding issue. See a hematologist. If you're somebody who already sees a therapist, talk to your therapist about it. You know, you're doing something that substantially alters your body, and hopefully you are doing it for yourself primarily. Be a good patient. Do what you are told. I feel like that made a significant difference for me. You know, eat the protein, do the medication exactly like they tell you, keep yourself spectacularly clean, keep your binder on. None of it is hard, but this post-operative list of instructions was arrived at over a long number of years with a large number of patients, and it's kind of evidence-based. Do these things and you are much more likely to have a great outcome. And if you have any concern, let them know right away, and they respond right away, like with the belly button thing. You know, I knew it wasn't right that I had fluid dripping out of my belly button. It would have never occurred to me to spray peroxide in there, but that's really all it took to get it to heal up. Do what you're told and stay in close touch if you have a concern. Good afternoon.
How are you?
I'm good, thank you. Are your ears burning?
I will tell you, it's like if somebody was going to do marketing, you are like the perfect.
We're the Mutual Admiration Society.